Diagnosing GI disorders is critical to effective treatment and preventing complications of the GI tract. In this video, we'll take a look at these diagnostic tests and procedures. Radiological studies are indirect visualization studies that view the lower GI tract. The simplest of these tests is an X-ray view of the abdomen used to detect gallstones, fecal impaction, and distended bowel. For this particular study, there is no prep. You can see an example of an abdominal X-ray on your slide. A barium enema is an X-ray exam that can detect changes or abnormalities in the large intestine. An enema of a liquid metallic substance, barium, that coats the lining of the colon is instilled into the bowel via a rectal tube. Client remains with the barium instilled while multiple position changes are done, and the air is instilled while the radiographs are taken. Normally, an X-ray produces a poor image of soft tissues, but the barium coating results in a relatively clear. The barium X-ray is used to detect polyps, diverticuli, and tumors. There is some prep required for this procedure. Before the procedure, you would need to make sure that the client has had an informed consent, a low residue diet for several days prior, then clear liquids, and then NPO 8 hours prior to the procedure. Some physicians may order a laxative, suppository, or a cleansing enema the morning of the procedure. After the barium enema procedure, bloating and cramping may occur. Clients may also feel the urge to defecate due to the large amounts of fluid and air instilled during the procedure. They may resume their food and fluids and meds as prior to procedure. Mild laxative and increase in fluids will help to aid elimination of the barium. It's also important for the client to know that their stools will be white or light for a few days post-procedure. You can see here on your slides the difference between a normal X-ray of the abdomen and the barium enema results. A computed tomography or a CT scan examines body sections from different angles using an X-ray beam to produce three-dimensional pictures. You can give contrast dye to enhance the visualization. If the client is receiving contrast for their CT scan, the nurse must check their BUN and creatinine to ensure adequate kidney function. There will be a restriction of food and fluids for approximately 6 to 8 hours, and they may potentially have a barium swallow as well. During the procedure, nausea or warmth may be felt, along with a metallic taste and a transient headache. Post-CT scan is usually a resumal of normal activity and diet and an increase in fluid to eliminate the contrast. However, some medications like metformin may still need to be held up to 48 hours depending on kidney function of the client. An ultrasound is a non-invasive procedure that requires no prep by the client like the abdominal X-ray. An ultrasound detects tissue abnormalities such as masses, cysts, edema, or stones. An ultrasound probe is moved over the skin surface of the abdomen. You can see the results of both the CT scan and an ultrasound on your slide. Direct visualization studies of the GI tract are used for diagnostic and treatment purposes. They are invasive procedures and are conducted by a gastroenterologist who inserts various instruments to examine the interior of the GI tract. The nurse's role during these studies is to prepare the patient for the test, function as an assistant, and provide aftercare. Before a colonoscopy, the nurse wants to secure that an informed consent has been signed. We also need to obtain a medical history to include allergies, any bleeding history, and medications to prevent potential complications from the procedure. Bowel prep before colonoscopy consists of clear liquids 24 to 48 hours prior, NPO the night before, and also drinking a gallon of the Go Lightly solution to clear out the colon. To get the gallon down, usually we have our clients take about 8 ounces of the solution every 10 minutes. Clients can be anxious about having a colonoscopy. It is important to describe the procedure, tell the patient who will perform it and where it will take place, along with what will happen during, and after. After a colonoscopy, it's important to observe the patient closely for signs and symptoms of a bowel perforation. These signs include severe abdominal pain, nausea, vomiting, fever, and chills. It is also important to obtain and record the patient's vital signs and neurological status according to your facility's policy. It is okay to instruct the patient to resume their normal diet, fluids, and activities after the procedure. Usually they are sedated for these procedures and will need a ride home if this is a post outpatient procedure. If they go back to the floor, it's important to provide privacy and allow time for rest. We also want to provide and encourage increased fluid intake to allow for replacement of the fluid loss during the preparation of the procedure. Other common diagnostic tests include laboratory studies of the feces. Testing for occult blood in feces, also known as the Guaiac test, detects colorectal polyps so they can be removed before becoming cancerous. It is an early screening tool that we use. You can generally perform these tests for the occult blood at the bedside, although some institutions require that it be done in the lab. It requires use of a special reagent that detects the presence of peroxidase, an enzyme present in hemoglobin. Only a small smear of stool is required. For home testing, remind patients to wash their hands before and after collecting the stool. A fecal fat test is primarily ordered when a person has signs and symptoms of malabsorption. These can consist of fatty stools that are loose and foul-smelling, fatigue, anemia, and or specific nutritional deficits such as iron or vitamin B12. Malabsorption is seen with a wide variety of diseases and conditions. Some causes of malabsorptions include diseases affecting the intestines, such as celiac disease, pancreatic insufficiencies, or diseases and conditions of the bile ducts and/or gallbladder. When testing the stool for ova and parasites, you can test for the presence of the eggs with tape. In the morning, as soon as the client awakens, press clear cellophane tape against the anal opening. Remove the tape immediately and place it adhesive side down on a microscope slide. You may also need to do perianal swabs for microscopic study. This test is used more frequently in pediatrics. Anytime you're collecting stool for a sample, be sure to have the client void first and then defecate into a clean hat placed in the back of the toilet. Do not fish stool out from the toilet with a tongue blade. A fresh stool sample is collected in a clean container. The stool sample should not be contaminated with urine or water. Once it has been collected, the stool should either be taken to the laboratory within 2 hours after collection or transferred into special transport vials containing preservative solutions. I want to go back to the occult blood test for a second. When doing this test, it's important to acknowledge that there are some factors that can give either false positive or false negative results, such as a female if they're menstruating, or an increase in red meat consumption will give false positives. False negative can be in result of a vitamin C and a high vitamin C intake. This concludes the video series for class prep on GI. Look forward to seeing you in class.